try this one more time.
There we go.
All right. Thank you, everybody, for joining us today. I appreciate it. And I hope that you find the information that Lauren is going to be sharing today on Medicaid waivers useful. Please let us know if you have any questions. You can either put it in the chat or wait and speak up at the end. But we'll be more than happy to answer any questions you have. And with that, I'm going to go ahead and turn it over to Lauren.
Perfect. Hi, everyone. I can't see you since I'm in presentation mode, but hopefully you guys can see me. My name is Lauren Schuler, and I'm the Director of Community Services Case Management here at the ARC of San Antonio. And today, she had asked me to present on the Medicaid waivers. It's something that we discuss with all of the families that we work with. It's a topic that I could go on and on and on about, but I tried to condense it down into just as few slides as possible, and then just to leave room at the end for questions too, because I know it can be a lot. So I really tried to break it down and keep it simple. And then, like I said, I'll leave time at the end for questions. I'm not an expert by any means, but I can at least direct you in the right direction. And my contact information will be at the end as well for anybody who wants to get that. So to jump in before we get started, there's a lot of acronyms when we're talking about Medicaid waiver programs. That's just the name of the game. And anyone who's involved in the land of disability is kind of familiar with a bunch of acronyms anyway, especially with the school system. But to get started, HHS refers to Health and Human Services. And SSLC is what we consider a state-supported living center. LTSS, you'll hear me go over that acronym a couple times. That stands for long-term services and supports. And a DID is called a determination of intellectual disability, and that's something that you kind of have to go through in order to place an individual on a waiting list for the Medicaid waivers. An ICF-IID is an intermediate care facility for individuals with intellectual disabilities or related conditions. And then you may be familiar with the term LIDA, is a local intellectual and developmental disability authority. And ACOG is the local authority for Bexar County, which I'm assuming most of the people on today's presentation would reside in Bexar County. And then an MCO is what we call a managed care organization. There's plenty of other acronyms. If you need clarification on any of them, just let me know. I can't see the chat again, but we'll go through questions at the end, or if Jennifer wants to jump in and let me know if there's any questions. I'll try to make it as clear as possible. All right, so what is a Medicaid waiver program? It's essentially something that allows the state of Texas to be flexible in how it spends money in providing those long-term services and supports to people with disabilities. It offers services that traditional Medicaid doesn't cover. And in the past, people had to live in a state-supported living center in order for Medicaid to pay for these long-term services and supports. There are different rules, qualifications, funding amounts, and different parameters around each of the waiver programs, and we're going to break those down here in just a little bit. But most of them, just as a general rule of thumb, do not look at parental income or resources for any person besides the person who you're placing on those waiver lists. So what exactly does waiver mean? Like I said, it overrides certain rules for how state funding can be used by waiving requirements for Medicaid. Most regularly, that's going to be family income, because typically family income is the determining factor in receiving Medicaid or not, whereas getting these waiver funding opportunities do not look at family income most of the time. And if someone meets the eligibility requirements, individuals can get the service they need in their own homes or other community-based settings instead of state-supported living centers. And that's going to be a common theme you're going to see running through everything I'm discussing. The goal is to get individuals out of those state-supported living centers and institutions and into community-based settings or in their own homes. And people who receive waiver services are also eligible for full Medicaid healthcare benefits in addition. So are waiver programs expensive for the state? You might think yes, but the average cost of a waiver program is actually only $51,000 annually. Covers things such as nursing care, respite, home modifications, dental care, therapies, caregiver support, also like employment services sometimes, rehabilitation, a lot of different services that they cover. But the average cost of an SSLC is $321,000 annually. And that's a big discrepancy. So far less expensive to invest in waiver funding, but the waiver funding that the state provides is so much less than we actually need. It's lacking so greatly. And that's something that we're still pushing for every time that there's a legislative session, to pull more names off of those waiting lists. But it's just not happening as fast as people need the services. So what do you need to know about the waiver programs? Currently, over 150,000 citizens are waiting for services in the state of Texas. This means that the interest lists for these waiver programs are extensive, some up to 14 plus years. And that's the unfortunate part of the funding issue that I was just talking about. An individual does not have to have Medicaid already to be placed on the Medicaid waiver interest list. That might be confusing. Once you're receiving waiver funding, you are eligible for Medicaid, but you don't already have to be on Medicaid to be placed on the list. It's imperative that you place your loved one or yourself on all interest lists that you qualify for, and because you can be on several different lists at one time. It's imperative also that you keep all correspondence that is ever mailed to you or emailed to you or sent to you, because it is very common that your local agency or authority will say, oh, we lost the paperwork. And then you can go back and say, oh no, look right here, this is when I sent it. This is when it was submitted. You received it on this date, so on and so forth. Also important that you contact the list annually just to verify status and notify them of any changes in address or telephone number that may occur, just so that they can get back in touch with you if need be. Excuse me. So how many waiver programs are there in total? In Texas, there are 7. There is the Home and Community-Based Services, HCS, Texas Home Living, Community Living Assistance and Support Services, which you'll hear me refer to as CLASS, MDCP, or the Medically Dependent Children's Program, Deaf, Blind, Multiple Disabilities, or DBMD, Youth Empowerment Services, or YES, and then the STAR Plus waiver. Again, each of these 7 programs has different rules, qualifications, funding amounts, parameters, services included, and I'm going to break those down here in just a minute. And the ones that have a star next to them, or the one I should say, is an individual must already have Medicaid to be considered for that Texas Home Living and STAR Plus waiver. Those are the only 2 that the Medicaid eligibility is a requirement prior. So HCS, or Home and Community-Based Services. It supplies services and supports to Texans with intellectual disability or a related condition so that they can live in the community. The big thing with HCS is that they want individuals to live in the community. Age and diagnosis requirement, there's no age requirement. You just must meet an IQ of 69 or below, or an IQ of 75 with another primary related condition. That could be things such as autism, Down syndrome, epilepsy, things like cerebral palsy, those types of related conditions. The financial eligibility is for the applicant only, so it does not take into consideration the parents' or caregiver's income, and the monthly income for the individual being placed on the list or receiving that waiver funding through HCS must not be above 300% of the SSI income limit. And then here you can see the approved living options. Those are important. So the approved living options are group home of 3 to 4 people, host companion home, or the natural home. So the home that they're already living in with their family or caregivers. Another important thing to note for HCS is the services are provided through your local intellectual disability authority. So that's going to be ACOG, like I mentioned, for Bexar County. They're going to be the LIDA. And then you cannot be enrolled in another waiver program at the same time, but you can be on other lists. You just can't be receiving waiver funding at the same time. So if you're receiving HCS waiver, you can't be enrolled in another program. But if your name comes up on another list, then you're going to have to choose between the 2. Services for HCS include nursing and psychological care. The big ones, residential and rehabilitation. That's something that not a lot of the other waivers cover. Respite, behavior services, therapies, different modifications, dental care, and a bunch more. Right? Those are just the big ones. Currently for HCS, a 14+ year wait. So you're going to see a common theme: the sooner the better in getting your individuals placed on these interest lists for these funding services later in their lives. All right, and then very similarly to HCS, the parameters are almost identical. The biggest difference is you have to be on Medicaid already. And also the wait list is not as long. So it's about a 6+ year wait for services, so about cut in half. But again, having Medicaid already, and then your monthly income has to be within 100% of the SSI limit. Same age and diagnosis parameters and services included. All right, so those two waivers, the HCS and Texas Home Living, those are supported and coordinated through your LIDA, like I mentioned, so ACOG for Bear County. These next ones I'm going to talk about are coordinated through Health and Human Services, and then broken down into more like territorial managed care organizations, like I talked about. So the next biggest one is going to be CLASS, Community Living Assistance and Support Services. It's a program for people with related conditions as an alternative to an intermediate care facility. And the HHS defines a related condition as a disability other than IDD that originated before age 22. So like I mentioned, that could be cerebral palsy, epilepsy, muscular dystrophy, Down syndrome, things like that. Again, there is no age limit. All ages, just has to be that the disability was onset before age 22, and you must meet level of care criteria for placement in an intermediate care facility for individuals with intellectual disability. But then the goal is also to not have that individual placed. You want to keep them at home or in the community instead of those facilities. Again, financial eligibility is going to be the same, just applicant only, monthly income within 300% of the SSI limit. And the only approved living options there is in the individual's natural home. So CLASS does not cover things such as group homes or residential options. It's meant to keep the individual in their home. Like I mentioned, a case management agency and a direct services agency are the ones who help organize the services needed to achieve maximum levels of independence. So they're going to be the ones coordinating those services that you see down there at the bottom, such as the nursing and psychological care, specialized therapy. So that could be equine therapy, music therapy, things outside the standard speech, OT, and physical therapy. And again, this is going to be a long wait list, 14+ years, because CLASS and HCS are the ones that the majority of individuals are going to be on, because they span the largest range of eligibility. Okay, now we're going to get into a couple of the more specific waiver programs. The first being the Deafblind Multiple Disabilities Waiver. So they provide home and community-based services to individuals with deafblindness, as the title states, and another disability in conjunction with deafblindness. It was created as a cost-effective alternative, again, to an intermediate care facility for individuals with IDD or related conditions. What's important to note for this waiver is they must meet a level of care need 8 for placement in an ICF home per a medical doctor. And so there's different level of need determinations, and they don't go from 1 to 8. I don't have the breakdown of those memorized, but it's something that the state uses to determine the level of need in individuals with different disabilities. And a medical doctor, again, would be the one determining that. The DBMD waiver focuses on increasing opportunities for consumers to communicate and interact with their environment. That's the main goal with the DBMD waiver. Again, no age limit. You just have to have a related condition onset prior to age 22, and obviously have deafblindness as well. Financial eligibility is the same, monthly income within 300% of SSI limit. And the living options here are a little bit more lenient. You can do a 1 to 3 person group home, sort of a assisted living situation, or you can live in your natural home. A couple of the big ones here include nursing care is included, social work is a big one. Obviously, audiology would be important when receiving this waiver, behavior services, chore providers, and then they work on adaptive aids as well. So this is a really good option for individuals with deaf blindness. And I didn't put it on here, but the wait list for this one, I believe, is also in like the 6 to 8 year range at this point in time. All right, and then another kind of more specific waiver is the MDCP, and it provides services to support families caring for children and young adults only who are medically dependent. Medically dependent is, again, going to be determined by a medical doctor, but it just encourages the deinstitutionalization of children and young adults who have either previously resided in nursing facilities or would do so if they didn't have the opportunity to live in their home. You must be under the age of 21, and again, you must meet the level of care need provided by a skilled nursing facility that would require that more intensive nursing care. And again, with MDCP, you have to be determined financially eligible for Medicaid, but it's only based on the child or young adult's income and resources, not the family's. The only approved living options are going to be in the individual's natural home, again, because they don't want to encourage institutionalization. And you cannot be enrolled in another waiver program simultaneously, same as all the other ones. And the big one with this is going to be that nursing care that individuals may require is going to be covered by this waiver funding. All right, and then a couple more non-IDD specific necessarily waivers is going to be the YES waiver. And this is a mental health waiver for individuals aged 3 through 18 who have any mental, emotional, behavioral difficulties and are at risk of being placed out of home in some sort of treatment facility or long-term care, mental health facility. They provide intensive services within a team planning process called wraparound. And I'm not extremely familiar, but there's going to be a team that will be put together if an individual is receiving waiver funding through the YES program. And they'll meet with you and they'll do these wraparound planning sessions and meetings and help the individual kind of be supported again in the home and in the community without being placed in a treatment facility. The big one here for services included is going to be the paraprofessional services, the non-medical transportation, supported employment, family support. So they do family trainings. And then for the eligibility requirements, you have to have a qualifying mental health diagnosis. So that's going to be obviously something that's provided by a psychiatrist or another medical professional. And you have to have an immediate risk of being placed outside of the home due to those mental health needs. YES is a short-term program. So unlike these other waivers that I just previously discussed, which are long-term, once you come up off the list and you're on the waiver program, you're on it until you don't want to be anymore or until death. YES waiver is a short-term program averaging about 11 to 18 months in duration. And for Bexar County, the people who coordinate the YES waiver is the Center for Healthcare Services. And then I put their phone number here, and I can send the presentation in an email after this, and she can distribute that to you guys if you'd like it. But yeah, Center for Healthcare Services is the main provider for the YES waiver here in Bexar County. And then finally, STAR Plus is another kind of more specific program. It's a managed care program for adults with disabilities age 21 or older. And adults get Medicaid healthcare and long-term services and supports through a health plan of their choice. So if they're receiving STAR Plus, there's different managed care providers or managed care organizations that they can choose from who will give them these services. And again, to receive STAR Plus, you must be first enrolled in Medicaid, similar to the Texas Home Living Waiver. And then for individuals who are right at that 21 mark, there's a transition between the MDCP program and the Home and Community-Based Services STAR Plus program. Receiving other waiver services, but if you're not, this is a fantastic option. And the big ones here for services available is the residential options, nursing care, dental care, adaptive aids, does not cover. All right, so the big question everyone has, right, is now what? That was a lot of information, and it's like, okay, you know, my kid's 15 and I've never heard of these waiver programs before. What do I do? There's two main things that I would recommend doing as immediately as possible. Call Texas Health and Human Services at this number and place yourself or a loved one on the interest list for class, MDCP, or DBMD. Obviously, class is going to be the most wide arching for the availability of services provided by the waivers. MDCP, like I mentioned, that's going to be the medically dependent children's program. So under age 21 with that medical level or skilled nursing level of care. And then deafblind multiple disabilities is going to be that other more specific waiver. So if any of those, you know, if you or a loved one meet any of those qualifications, call Health and Human Services and get that intake process started. It's just a phone interview with them. And then the next step, number 2, would be to call ACOG if you live in Bexar County, or your local intellectual developmental disability authority, which I can give information on specifically if there's outside of Bexar County, anyone outside of Bexar County on this presentation, and begin the process of placing yourself or a loved one on the HCS and Texas Home Living interest lists. And then I added the ACOG phone number there for you guys as well. With ACOG or your local authority, they're each going to have a little bit different qualifications or processes in place for placing an individual on the interest list. Most commonly, ACOG, again, the one I'll refer to most, you'll have to go through submit an intake application, and then from there you'll be put on a wait list for a disability intake interview, or the determination of intellectual disability, I should say, the DID that I mentioned earlier. And then after that interview and the disability is determined, you or your loved one will be placed on the interest list permanently. And then that process, honestly, from start to finish with ACOG or your local authority can take anywhere from like 6 to 18 months at this point, because ACOG is pretty far behind on their intakes. But like I said, it is imperative that you get that process started as soon as possible, because again, those wait lists, like you saw, are very long at this point for the ones that the most people need.
Lauren, we have a question in the chat, and they are
Absolutely.
asking what the number for the yes waiver is.
Yeah, let me go back to that slide. That's going to be Center for Healthcare Services. And that number is here at the bottom, is 210-261-1135.
Thank you.
Absolutely. All right, and then let me go back here. Any other questions? I know I kind of breezed through that, but I feel like it's easier to ask or answer specific questions about these waivers once you kind of get the information in your brain. So any questions, I'm happy to kind of try to navigate through.
Parents, you are able to unmute yourselves and ask any questions that you might have.
Please, yeah.
It doesn't look like anybody is. Yeah, nothing's coming through the chat either.
Okay, not a problem. So just in closing then, if you'd like to speak with me or another case manager at the ARC, you can submit an inquiry on our website or call our main line and ask to speak to the case manager of the day, and we'll get you directed to the appropriate program. And then just in specifics, there's my number again, 490-4300. I'm extension 122. If you're interested in case management services, if you have additional questions about the waiver programs, if you want additional assistance with placing your individual or loved one on the waivers, interest lists, please feel free to reach out. We have the 2 locations here in San Antonio. We're at West Avenue, the case managers. but that's our information. And I really appreciate you guys, listening today and taking the time. I know it can be overwhelming, but I'm happy to send follow-up information and help out in any way.
Thank you so much, Lauren.
Thank you.
Absolutely. Thank you guys for having
For
me.
everybody that's signed into the sign-in sheet, I will be sending the presentation to your email provided. So if you have any questions, I believe you have a spot in there that you can ask as well, and we can address them for you. Does anybody need the sign-in sheet, or was everybody able to access the links?
I think we do, Art Ibarra. I'm sorry, yeah, right here.
Put the sign-in sheet in there one more time.
Okay.
And we will definitely get this information to you. And as always, you can reach out to Lauren, as she said, or
Please.
the transition teacher for your cluster school. And if you're not sure who that is, I'll be able to tell by the sign-in sheet, and I'll definitely send that information on to them as well. Does anybody have any questions?
Nope.
We'll go ahead and wrap this up, and everybody have a good afternoon.
Thank you so much.
Thank you.
Thanks, Lauren.
Thank you.